It's my pleasure to introduce Right Honorable Barrister Kwamoti Bitrus Laori, who has a motion that he feels is urgent for your consideration. Honorable Bitrus.
As Kwamoti Bitrus Laori, representing Jamsa Numan-Lamode Federal Constituency. Honorable Speaker, I have a matter of urgent public importance on the need to mitigate the spread of diphtheria, a major health concern in Nigeria, to save lives. This motion is brought pursuant to Order 8, Rule 5 of our standing rules.
Chair rules, please.
It's a matter that has to do with lives, and I felt and I urge the House to consider it urgent for me to move now. I so move.
I remain Honorable Mukhtar Tolani Shagaya, representing Nigerians starting from Laori West, Asa, Federal Constituency of Kwara State. Mr. Speaker, I rise to second the first leg of the urgent public importance ably moved by my senior colleague, Honorable Laori. I so second.
Infection caused by Conibacterium species has become a critical public health issue since the outbreak in Borno State in 2011 claims 21 lives. The outbreak's current resurgence poses significant threats to Nigeria already overburdened public health system. Also note that diphtheria, which affects the nose, throat, skin, and in severe cases the heart, is transmitted through respiratory droplets, contaminated objects, and crowded unsanitary environments, making its spread particularly rapid among children and those with compromised immune system in crowded communities. Aware that diphtheria thrives in Africa due to low vaccination rates while remaining virtually absent in countries like the United States of America and Europe, where vaccination coverage is high. Thus, diphtheria primarily threatens unvaccinated individuals who travel internationally or come in contact with infected persons. Also aware that in Africa, nations such as Niger, Gabon, and Mauritania have reported outbreaks with only a handful of confirmed deaths due to effective vaccination coverage, early detection, laboratory confirmation, and availability of antitoxins and antibiotics for treatment. In stark contrast, Nigeria's statistics paint a dire picture with thousands of reported cases and associated deaths due to low or absence of vaccination. Alarmed that from May 2022 to February 2025, Nigeria has reported 41,978 suspected cases of diphtheria from Bauchi, Borno, Jigawa, Kaduna, Katsina, with Kano and Yobe states accounting for the highest number, 24,062 and 5,330 respectively. Most cases were within the ages of 1 to 14, and only 19.7% were fully vaccinated, resulting in 1,279 deaths within this period. Concerned that if nothing is done, the high case fatality rate could worsen and spread outside the states already impacted, underscoring the urgency of improving on the low vaccination rates, ineffective in antitoxins and treatments, and delay in clinical detection and test confirmation that fueled this outbreak. Therefore, the House resolved: 1, direct the Federal Minister of Health, the Nigerian Center for Disease Control, and the National Healthcare Development Agency to enforce the mandatory diphtheria immunization, testing, and treatment across the healthcare centers in all the 774 local government areas. Number 2, task the Federal Minister of Information and National Orientation to raise public awareness through sensitization campaigns regarding the dangers, symptoms, and transmission modes of diphtheria to prevent further spread and fatalities. And lastly, thirdly, mandate the House Committee on Health and Health Institutions to assess the level of compliance with mandatory diphtheria immunization, the capacity of health institutions to effectively respond to current health of diphtheria spread across the country, and report back within 4 weeks for further legislative action. And lastly, mandate the Committee on Legislative Compliance to ensure compliance. I so move, Mr. Speaker.
Those against should say nay. The ayes have it. This motion is referred to the Committee on Health Institutions and Information and National Orientation for further legislative action. The next motion